Very good afternoon, everyone. The topic is an innovative low-cost dry eye treatment. Now, dry eye is defined as a dysfunction of lacrimal functional unit, an integrated system comprising of lacrimal glands, ocular surface, lids, and sensory and motor nerves that connect them. So mostly the dry eye, the common type is in India is MGD based, which is associated with diabetes and poor lid hygiene. Also, the weather here is more humid, therefore MGD is more common here. The treatment modalities for dry eye most commonly use lubricants like CMC or anti-inflammatory agents like cyclosporin and steroids. Now, various device-based therapies have come up in recent years, the example of LipiFlow or IPL. However, these devices are very costly and the patients can't really afford the therapy for long term, and the doctors also are not able to buy these machines to give the therapy to the patients. Keeping this in mind, we have designed an innovative approach to dry eye treatment where a low-cost device is used which is similar in effectivity to LipiFlow. The purpose of this study is to describe an innovative low-cost dry eye therapy system as compared to much costlier alternative available in the market. The study was performed at a eye hospital in North India. A therapy protocol was designed where low-cost heater cum massager costing rupees about 10,000 was used to treat dry eye diseases caused due to meibomian gland dysfunction. A data of 39 patients aged between 43 to 59 years was collected. Of these, 27 patients went therapy using novel device, whereas 12 underwent therapy using traditional treatment of warm compressors, what we tell to the patients. Now, this is the massaging unit which I am going to demonstrate about. So, this is how the unit is placed on the patient's eye, and as per the protocol which I have designed, I will explain. Now, what it does is that at optimal temperature of 41 to 42 degrees Celsius, it keeps the warmth to the eye area around the eye, and it has compression also, which gives compression at the interval of every 3 seconds. So apart from heating, compression is also done in areas around the eye. This leads to loosening of the clogged meibomian orifices, thus resulting in resolution of MGD. The device is used for 15 minutes at a time and once every 3 days for 15 days, that is total 6 sessions were done. Now at the end of 1 month and 3 months, the following diagnostics was carried out, that is Shermer's test, TBUT and OSGI questionnaire. All the patients were prescribed 1% CMC eye drops as a placebo effect. The results of these 3 tests were compared with those of traditional therapy group and with values from before treatment. Thus, what we see here that the mean values pre-treatment of Shermer's test was around 25 millimeters in both the groups. Now, this Shermer test is more than normal. We might say in the FP4 range, because of the inflammation caused due to MGD. Now, at the end of 1 month with novel device treatment, the Shermer value has decreased to 16.7 millimeters, whereas in the traditional therapy, it has gone to 19 millimeters. While at the end of 3 months, it has gone to fair normal range, 14 mm, and at the end of 3 months for traditional therapy, is also around 14.7 mm. So what we see here is that at the end of 1 month, the novel device therapy has a much better treatment result, but at the end of 3 months, both the devices have a similar efficacy. So the novel device gives a faster resolution. The patients in both were also symptomatically much better from before therapy. The conclusion is the innovative solution is a low-cost dry eye treatment alternative to devices which are available commercially and thus makes the therapy accessible to a majority of doctors and patients who otherwise would not be able to afford to buy them or pay for their therapy respectively due to financial constraints. Thank you.
Ankit, have you patented this device?
Sir, I have not invented this. This device is available commercially on Amazon. I have just changed the software a little bit and made it like I have checked the temperature that it should give a continuous 42 degrees Celsius and 15-minute cycles. That's what
so you have not given the credits for that particular thing, right?
No, but it's generically available in.
If it is available in the market, it's not your device. You're supposed to give a credit to the person who has given it to you. Okay. Second thing is, did you document the meibomian glands, pre and post?
Yeah, we don't have.
And how?
We don't have a mammographer with us. So using an autoref, we try to take pictures of the meibomian gland. So that's all the documentation I have. So what I noticed was that there was some improvement in the membrane gland, but it was, the pictures were not very clear. I could not, demonstrate them using the slides.
Now, how did you measure the T-butt? Did you measure the T-butts with the lubricants on or without the lubricants?
No, the T-butts were measured without the lubricants 3 days back. 3 days of lubricant was stopped, then T-butt were measured, and we used moxifloxacin eye drops to moisten the Shermer's, the fluorescent strips to do the T-butt.
You have a topographer?
I don't have.
Okay. Thank you.
Thank you.